Well, thank you for tuning in to Meet the Candidate. My name is Annie Lynette Taylor, and I am joining me, I should say, today is one candidate who is really not unfamiliar with the entire judicial and the candidate side of things. But we're going to talk to her in just a moment. Her name is SharonMcDonaldEvans, and she is running for the NC House District 8. And of course, this is part of Pitt County. So this is very important. If you're out there in the Pitt County area, you should definitely listen. And so Sharon, I want to say thank you for being here. And thank you for also deciding to run. Why did you decide to get into this race?
It is so interesting. Well, as you know, I am Candy Smith, Representative Candy Smith's political lead strategist. Mm-hmm. And when she was thinking about whether or not she was going to run for her current seat or run for a Senate seat, I started thinking ahead because that's what I have to do for her anyway. And I was like, okay, who are we going to get to run in this seat who can continue the same legacy and have the same tenacity that she did? And I was like, no one but me. And so once I did some research and investigation to make sure I could still do my political advising and things like that, once they said yes to that there was no conflict, I said definitely. It's going to be me because there is no better candidate.
That's amazing. And I think of that because you have not only worked with Candy Smith, you worked with so many current candidates right now that are actually in their positions. Like I think of Ferris Dixon, who is the Pitt County District Attorney. You've worked not only with Candy, like she is of course in the state level, but you've also worked on the federal level.
Yes.
I mean,
fortunately,
yes. But you Roy Cooper, of course, our governor, but yes. When I think about Obama and the Biden administration,
yes, amazing.
You have worked in those levels, and yet I think of it as like you've been the bridesmaid, now you're becoming the bride. And deciding to put your name out here. And I just think for someone who's a strategist, it seems like this is going to be so easy for you because you know the ins and outs.
It's easy in a sense, but then it's not easy because you still have to face the reality of you have to run a good campaign. Yeah. Anyone is subject to lose or win a campaign. It's just how you operate and how people connect to you. So fortunately, I am confident, but I'm not overconfident ever. I don't take anything for granted. I'm gracious, but I do plan to win.
Yeah.
So, you know.
And you play to win because this is your track record.
It is.
And anytime you have a candidate that you are working with, they are ones that come out on top. I think of Sheriff Dance also.
Absolutely. And I wasn't giving her up, so I'm still her campaign manager.
Wow.
So that was my first question.
Yeah, and see, people are going to think, wow, this is one busy woman. How do you think you'll balance all of that, running your own campaign and others all at the same time?
I do it anyway. And I tell people, and when I put my team together, they say, okay, how are you going to do this? I said, I do it anyway, except it's easier because it's me. I know what to do. I don't have to coerce a candidate into doing this. I don't have to harass them. I don't have to send them text messages because it's myself. The only downside of that is I give myself leeway that I don't give candidates.
So you're not as tough on yourself?
I'm not as tough on myself, but I know how to pull it together.
Oh, I know it. And, you know, pulling together to me shows how much you care about this community. You will pull it together anytime because you've worked in the healthcare arena, I should say. You've worked many years in healthcare. And that's one of the things that people are really kind of thinking about, especially in Eastern North Carolina, Pitt County. What are some of the challenges that you're seeing with healthcare?
I'll tell you one thing. I called some of my old co-workers at the health department and the state health department and said, I'm so glad I'm not in my position there with you all now. Simply because of all the mixed messages and all of the confusion and just dealing with the pandemic in general, because these are unprecedented times and I do feel for them. And they've worked an ungodly amount of hours. And we did that anyway. Regardless of what the pay was, it was the outcome for the people that we were serving. So I've been grateful that I'm not directly there with them, but you know, they still call me all the time. I'm here, but it's been challenging. It's been very challenging. COVID is something nobody ever anticipated, and it's not going away at all. So what I do now is I try to balance it out and try to encourage people and be supportive of what the CDC is recommending and things like that, and just say, look, pay attention to the science. But ultimately, people have to make their own decisions. But they make their own decisions based off how they connect with the people that are telling them the information, how they're receiving the information, how it's given to them, and things of that nature. And I'm very honest and open with people about those factors. And people get into shots or no shots, and I said, listen, you have to look at the benefit. When the benefit outweighs the risk, then sometimes you have to take that chance, because what I don't want to see is people with underlying issues on a ventilation tube or at the point of dying. And, you know, connected with that, I have a mental health background as well. And this whole factor has been depressing for everybody. And if you have not been the least bit affected, and I'm not a person who gets depressed, but this is depressing.
It's been hard on a lot of people.
It's been very hard. I've cried with people. I've sympathized with people. We all have put on that COVID 15 or 20 because I didn't even want to go outside and run.
Right.
You know, I was scared I was going to catch a cold, not know the difference between cold and COVID.
Right.
You know, and you don't even want to sneeze in a public place because people will think you have COVID.
Right.
You know, and I'm looking at people that way too, and I'm in the places and they sneeze or cough, and I'm looking like, oh, gotta go.
Right.
Gotta get out of here.
This is allergy season, so you know.
It's just something. But it's even worse when you have to look at the children who are impacted by COVID and things like that. And you have to look at the parents' decisions, and you know, when people talk about that, so they gave birth to that child, they can't tell them. All I can tell them is give them some information, and I parent my own children and worry about them and my grandchildren's health and safety. Yes.
And health, of course, with mental health, like you just mentioned and alluded to, we've seen a lot of issues with that. We've seen a decline in the amount of help that's out there. How do you think you can position in the state level to bring about more resources for people who have mental health issues?
So I will tell you this, my physician and I are really good friends. My gynecologist, she's my favorite physician. I tell her she's probably the only one I ever listen to. The rest of them, I give them a hard time because I have a health background and I've taught medical students. So I don't really listen to them, but I listen to her. I love her. And when I told her that I was running and told the people in her office, after we all started laughing about it because of things that I'm going to say and do.
Right.
And it's like, oh my God, I think it's great. So we definitely need another overhaul of the mental health system. And I'm not going to be critical about any decisions they've made because things are always different when you're on the outside. But when you're in the inside and you're actually looking at that 200-300 page budget and you're looking at hard choices that you have to make, you have to look at that. But I think there's some ways that we can partner with some of the nonprofits who have stepped up to the plate to do mental health services and things like that. So I think there's some things that can be done to improve the system. And the whole redesign was done so that they can make improvements that they thought were going to be good. Didn't necessarily turn out the way they anticipated, but I think there's some ways that we can make a big difference, and so that's part of my plan. I just hope I can keep my hands in it. They may not want me at the table because I'm going to definitely advocate what's the best for the people in my district first, and then the people in the entire state of North Carolina, but my district is my priority.
Well, a lot of people in this district have been impacted,
yes.
And especially even with Medicaid.
Yes.
Because on the state level, when that was eliminated, how many people were on the outside looking for health care and thinking that the Affordable Care Act would be, the end-all be-all.
And they don't qualify.
Right. And you've worked in that sector as well because you were enrolling people into the Affordable Care Act. And that
still do.
And you still currently, yes.
Yeah.
So you're seeing it from both sides, how the impact in this area, for so many people, they were not able to afford it and then went without.
Right.
How do you hope to fix that problem?
Oh, I'm an advocate for Medicaid expansion. That's the top thing on my agenda because we definitely need Medicaid expansion. We've been too long without it. There's a tremendous need. You have people not going to the doctor. And when people can't get their health care needs met, it affects everybody. It doesn't just affect that individual and their family. It affects all of us. And as a society, we should care about people not getting care. That's important. We should care about how you're treated when you go in, whether you have private insurance, Medicaid, or no insurance. There should be no difference in treatment. Your treatment should be the same. And so I'm definitely going to push for Medicaid expansion because it's an absolute necessity. It still won't fix everything, but it will help us tremendously. Especially even with our economy, because once people can go get the care they need, then they can go back to work.
Yeah.
And they can feel better about themselves. But we've got to have it. Our hospitals even need it because they're missing that revenue. Yeah. I think at one point in the beginning of the lack of Medicaid expansion, I don't think the hospital administration in different areas really were paying attention to how much it was going to impact them. And I don't think they really were okay with advocating for it, because you're talking about advocating for the underserved population. And that's a population that I always advocate for. And so now that it's hitting them differently economically, the hospitals are on board. I've got several calls to several committees with them and, consult and help them through this process, because they want Medicaid expansion. Yeah, you need it because you're missing the revenue.
Yeah.
Whether they're underserved population or not, you're still getting paid by Medicaid. And in this part of North Carolina, our hospital serves 26 counties or so, maybe more than that. And so that's a big impact, and we need that. We need those revenues.
Yeah. And I think that the hospital, of course, like you mentioned, had struggled. And it's been, I guess, aspirated because of COVID. They've seen a shortage with nursing. Or nurses, I should say, that are not in the hospital for whatever reason. How do you think we can help bring about change so that we'll have more nursing staff members?
Well, it's twofold. So the nurses are enjoying themselves with being travel nurses. And I told a lot of my friends, girl, I should have stayed in nursing class. I should have kept that major. But nursing just was not for me. But certain aspects, but now it's very appealing to me, because they're making more money than they have ever made in their lives. And they deserve it. Because our nurses work really hard to provide care. Some patients connect more with the nurses than they do the physicians.
That's true.
And because they're going to talk to them more on a personal level, but they work in tandem with the physician. And so I never want to, belittle that or anything like that, but I'm glad that they're finally being appreciated.
Oh, yeah.
Because they need that. The shortages are triplefold. Like, I talked to our community college systems and things like that, because I try to stay in tune with what's going on, and not to be nosy, but I want to know, what are you doing for your classes? How are we modifying this for COVID and things like that? And I will say Pitt Community College has stepped up to the plate. They have done some phenomenal things, and they have had the largest classes of nurses ever.
Wow.
During this shortage, and they're trying to help the hospitals out by meeting their demands. And so they've modified the spaces in the classrooms. They've had larger spaces for the nursing students, because they got to be 6 feet apart.
Right.
And they don't want to have an outbreak. And fortunately, they have not had one, to my knowledge. I think I'm pretty correct about that. And it's been a blessing. So the shortage is, in some other areas of the state, not Pitt County, some other areas, some of the community colleges have not been able to make some of the modifications that we've made. And so they have less people enrolled in their classes, which means there's less people to go into the field. And everybody's feeling the shortage. The other thing is that all nurses are people too, and they have healthcare needs. But you have nurses who don't work for a system full time. They don't have insurance.
Oh, wow. I would never imagine.
That's right. People don't think about it. You
that
don't
they
understand.
Didn't have it.
They don't have insurance. Some of them enroll into the Affordable Care Act, or Obamacare, which we call it. We've embraced it. And they have to pay for their own coverage.
Wow.
Because if they work part-time below certain hours, they don't get any benefits.
That's amazing.
And
they're out there trying to help.
They're out there
other
trying
people.
to help other people be healthy.
Yes.
And they can't go to the doctor themselves.
So there's a huge problem, and it's twofold.
It's twofold.
And speaking about that too, when you were talking about having the community college, the aspect of teaching, we have a shortage in our public school, because I believe it starts there too. Our public school system has suffered because teachers honestly been overworked during COVID. They had to pull themselves, or they were pulled out of their classrooms. They had to do things from home. They had to be their own IT person. They had to learn how to get the kids engaged. It was a whole new way of learning. But teachers in our state typically start out about $35,000 a year.
If that.
And so when you look at that and the amount of work that they have to do, it doesn't seem like a lot of people are going to be running to go into the teaching profession.
Not at all. And I will tell you, I'm 56. So I've taught school before. I was a teacher when my kids were young, and it was perfect because I could have the same exact schedule that they did. I divorced early, so I had to parent basically the entire time by myself.
Wow.
And so it was rough. And when I was a teacher, I had 2 part-time jobs. Wow. I had a master's degree.
Oh.
And I was barely making $32,000 with a master's degree from ECU, 2 degrees.
Wow.
And that's crazy.
That's
you
unheard
know,
of.
and I had to have 2 part-time jobs in order to provide for my kids because, again, I didn't have a husband. I was single.
Yeah.
So I understand that struggle very well. You got to pay daycare, girl. I was so glad when Martina got out of daycare. I didn't know what to do because my kids are only 17 months apart.
Oh my gosh.
So
You're young.
right.
Young
So I
kids.
had 2 in daycare at the same time. That is tragic.
That is. And
Because-
that's your whole paycheck.
That was financially debilitating,
Yes.
which is why I had essentially 3 jobs.
That's unbelievable.
But I had to make it work. North Carolina is the 9th largest state in the country, but we are ranked 43
That's so
with
dismal.
salary. It's horrible. So trust me, as an experienced teacher going through that process, and I loved it, loved every minute of it, but I can't imagine teaching now. First of all, I would not do it for the pay. Absolutely not. No way. And with everything that they have to do, it's unbelievable.
It's a
And
lot.
online, and sometimes online and in person, no way. And then you got to deal with kids, parents don't want to wear masks. I need to protect myself.
Right.
So if I'm your kid's teacher and I want to wear a mask, then I expect every child in here to have one on.
Right.
Because we got to protect each other. I don't want what they have, and I don't want to give them anything. So, I mean, that's just how it is. I'm very straightforward, about things like that. And I empathize with my friends who are still in the system and they're struggling, especially now with this lifting the mask mandate. Well, in a few more months, we'll be right back knee deep in COVID.
And that's scary.
We are. And we've had teachers who've gotten COVID from the classroom, and they are burnt out. And mentally, a lot of them have used more mental health resources probably than ever before. I haven't looked at the data. I got to see what's available, but I'm pretty sure just from talking to people here in our county, they have, because it's depressing.
Well, I mean, the money isn't
And the
there.
money is terrible.
But is
So,
the money there in the state to provide those
so.
salary increases?
Again, if you understand how the state budget comes, so the budget comes to a legislator sometimes 200-300 pages.
Yeah.
That's a lot. And sometimes you only have 24 hours,
Right. to
48
read it all.
hours. That's physically impossible. So I'm an early bird. Like I said, I'm 56. I go to bed at 8 o'clock. I shut down.
Because you got to get up early.
And I'm not talking to
running.
people unless it's the sheriff after 7 o'clock. And my children.
Right.
They're the only exceptions. That's everybody else go to voicemail.
Yes.
I am not up that late. I just can't. I'm a morning person. I'm up at 4 or 5 o'clock a.m. So I'm up working, getting stuff done early in the morning. But I'm not an evening person. In the evening, I'm exhausted.
Of course. You're
And
working all day.
so I just can't imagine going through that budget in 24, 48 hours. But it's something that's going to have to be done. I think realistically and honestly, I think there's something we can do about that. I plan to advocate for that with them. But then really look at that budget and see what areas, how we need to prioritize this. Because if you think about it, our teachers mostly live where they work. So if they made more money and they act like me, they're shopping. And they're spending more money with the local shops. So that stimulates the economy. It's a trickle down effect. If they got more money, they're spending more money because they can pay their bills, they got some left over. Right now, they don't have much left over. And so they can pay their bills. We have some teachers that can barely pay their bills.
Right.
I mean, that's just the reality of it.
And still work 2
And
jobs.
still work 2 jobs
Yeah.
if they can find one that's feasible, and so, even with me, I had to work jobs that made sense. I had to work jobs that weren't going to require me being out the house at night because I
You have
had
kids.
them. But see, back then in the 90s, I could, when I left work at 3 o'clock, I was done. Wasn't doing anything else. These teachers are not done at 3 o'clock. They're still there to 3:30, 4 o'clock, 5 o'clock, 6 o'clock. And I'm like, oh, no way.
Yeah.
And for that pay that they get, it's ridiculous. And the assistants, it's even worse.
It's even worse for them.
It's worse.
And that's the
And I know I
tragedy.
couldn't have survived without my assistants because let me tell you, I taught William kids.
Oh, really?
So that's the most aggressive behavior in the state of North Carolina. Loved every minute of it, but I'm going to tell you, it's challenging. I would not have been able to survive without my assistants because I relied on them. So, yeah, they need more money too because they're helping me with classroom management.
They do a lot.
They do a whole lot.
And they're underappreciated. I think that people started to see and appreciate teachers, like you said, during COVID, especially parents who had to start teaching their own children. And they were like, oh my gosh, this teacher has to do a lot. And she has 10 times or 20 times the amount. When you have this one child, multiply by 20.
That's right.
Classroom sizes are huge. Sometimes they have more kids than they can really handle because of the shortage of teachers. But when you look at that and the fact that, like you mentioned, they have to work several jobs to make ends meet. We're looking right now at an issue with our gas prices. That is breaking people. Just to go to the pump, and I will look and I will see like someone has gotten 10 gallons and they have paid like, $40, $50. And I'm just going, wow, where in the world?
Let me tell you, I don't know how many gallons I got yesterday. But when that thing said 40, and I have never put more than $30 worth of gas in my car on E, and I wasn't on E when I filled it up. I had a fourth of a tank. I was like, and I have to use premium.
Right.
So I paid $4.87. So it's funny you bring up gas prices because that's been at the top of my mind. And I'm like, okay, gas prices are basically regulated by the federal government. As a legislator, can't do much there, but I can impact that North Carolina gas tax.
Yes.
And so if you did you know North Carolina had a gas tax?
Of course.
Okay, but some people don't know. Some people don't know.
I see that gas tax. Oh, yes.
And people don't pay attention to it because you just looking and you're like, oh my God. So gas tax cannot go below 36.1. I've already looked at this.
Yeah.
And so there is some wiggle room where we might be able to cut some of that. Again, don't know everything is good to say stuff as a candidate.
Yeah.
It's different as a legislator.
Yeah.
But as a candidate, my pie in the sky is we need to cut that by 50%. And I know DOT won't really like that initially. And I'm not talking about a permanent cut. I'm talking about a temporary cut. Because 50 cents to me off that gas price is going to make a significant difference.
I think for everyone.
Because then you have to look at what choices you have to make. And if you think about teachers, you think about teachers' assistants, you think about people that work in a grocery store, people that get paid hourly and things like that, people that are already on a tight budget, they have to make hard choices. They have to decide, okay, I had to pay $4.87 for gas to get to work, so I'm going to have to reduce my spending by $50. That means I'm not going to be able to buy certain types of food. I'm eating unhealthy because it's cheaper to eat unhealthy than it is to eat healthy foods. When I was trying to lose weight, eating healthy, my food budget doubled.
Right.
And I was like, oh, I can't eat like this forever anyway, and I don't want to because I want a bag of chips and some candy. But it's just cheaper. They have to make hard choices. So they're choosing to buy things that are not necessarily healthy, but that impacts their health. And God forbid if they don't have health coverage.
Oh my gosh! And
you see the trickle down effect.
Yes.
It just does. So I think there's some things that we can do about that.
It's
hopefully,
important.
I think we can do it. It might be a battle. And I'm not talking about permanent, just until these prices come down some, even if we do it for 6 months. 6 months is better than none. We can look at what DOT needs to fix these roads, and they do a great job. And I know I'm one of those some people don't, but I would contact them and complain about the railroad tracks, the roads, because that affects my car alignment.
Absolutely.
And that's expensive. And I had to get an alignment twice in 6 months because of the raggedy railroad tracks. But, know, DOT came through. And they fixed it through advocacy.
Yes. Something that you know how to do so well. And just imagine you're doing this, you can do it for everybody.
Right.
Because you know the steps, you know what it takes to get to the people in charge. And I always think about when we're talking about, you were saying, people who are traveling and they have to go back and forth to work, they're going to, of course, cut back on their budgets. But what if people who don't have transportation? They have to rely on the public system. And when you think about Pitt County, it's a vast county. It's huge. And everything seems like it's centered in one place. But if you're on one spectrum of the county, there's not a lot of public, no public driving transportation for options for them where they can get from point A to point B. Is there any way we can affect or that you all can do something?
Yes. It is.
Good.
And, one thing, we've got that beautiful transportation center.
We do, yeah.
Thanks to G.K. Butterfield. Congressman Butterfield came through on that and really helped us with that. And I think there are some other funding opportunities we can look at. And I think there's some discussions we need to have with the city councils and the mayor about that, because you definitely need to expand to the more rural parts of the county. I think about areas like Bethel, Fountain, Falkland. They don't have any form of public transportation. None. They don't have any taxi cabs in that area. So
just
if you
Ubers.
take a taxi, you're paying a lot of money.
Yeah.
And I tell people, I've had clients in that area all the time, it's cheaper to pay a friend. But now you can't afford to pay a friend because gas prices are so high. You can't give a friend $20 and expect to get to Falkland and back. They're going to be like, we need 30 or 35, and they don't have 30 or 35.
That's right.
So there's some ways to look at that, but you can't really encourage a lot of carpooling during COVID.
I know.
Because you got to ride with a mask on. You got to ride in the back seat. One window needs to be down. It's a whole lot of stipulations and stuff. And it's driving us all crazy.
It is.
But there's something we definitely need to look at. We don't need to have transportation just concentrated just in the city of Greenville. That transportation system should be expanded. And there are ways that we can help as legislators to help support the city in that. And there are ways that we can encourage the city, hey, look at your own budget. Let's talk about this. You all have money, so let's talk about how you need to redistribute this
and help them. Yeah, that's in their community. And speaking of that, these rural communities, not only lacking transportation, sometimes even having food deserts in certain areas where they only have a small little country store. Nothing wrong with that.
No grocery store.
But no grocery store where fresh food is available.
And they have to go where? Yes. Here, basically, to Greenville. And that's a struggle. On the state level, I've been working with them on several projects about food deserts through Cooperative Extension and through Department of Health and Human Services and things like that, and offering programs and offering other resources and trying to support nonprofits to have food available, fresh food for the people in the community. So it's a lot. Y'all are gonna keep me busy, and I know that's why I'm gonna be. You're gonna keep me busy. I'm gonna be tired, and as I advocate for them, I'm be advocating for more pay for the legislators.
Because you're all gonna be running back and forth.
Because we're gonna be running back and forth. We're gonna be exhausted. They stay up late, and I get irritated when it's late.
When it's late.
So
because you go to bed at about 8.
I go to bed by 8.
So we know you can't keep.
And I really don't like talking to people past 7.
I know, but if they got up at 4 and then
we'll be on fine. They can get up at 4 o'clock
and call you.
Yeah.
Well, I want you to talk to those, in your area, the constituents, those who are looking at this and saying, why should I vote for Sharon McDonald-Evans?
Of course, I'm going to start out saying because I am the absolute best person, because I am. But you want somebody who has the capacity to fight for what you need. I'm a fighter, 100%. I enjoy it, actually. Yeah. Some people don't like conflict or fighting. That's always been my thing. I've been that way since I was a little girl. My aunt, if you think I look good, she is 76 and don't look a day over 40.
Wow.
She looks great.
Good genes.
Yeah, blessed, because my mother is deceased. Blessed with good genes from both sides of my family. Wow. But it's just amazing at how you need somebody that's going to be a fighter. And she'll tell you, I've been a fighter since I came out the womb, and never really too humble. So I'm always be confident. That's just who I am. And everybody can't take that. And that's okay. You don't need that. You need somebody that's going to stand up to the other legislators and say, no, we're not going for that, because part of my campaign slogan is people over politics. Yeah. And I mean that 100%. People are more essential than politics or your political gain. I don't have any political gain because I pretty much get what I want, and because I know how to make it happen. So if you want somebody that understands what you need and to help you get what you want, then I'm your girl. Especially because I come from a health department background. I come from a mental health background. I come from an education background. So my background is very diverse, and I'm always fighting for underserved. So I can mix in with any population. I can fight for the underserved, fit in with the middle class, because I say I'm in the lower middle class, because right now with the taxes and everything else, we're all struggling together. And I can function with the upper class because I'm asking them for money.
Yes.
But you know, the thing is, you want somebody that understands you. And I've been here probably, 37, 38 years, had no intentions on staying here that long because I'm originally from Fayetteville.
But here you are.
And Greenville has become my second home. Fayetteville's always home, love being home. But Greenville has become my second home. And I believe in fighting for the needs of the people in the district, which is why I said there is no better choice than me.
Well, we do hope that people will go out and vote. We know that the primary is going to be pretty much on May 17th.
Yes.
We also know that the general election is coming up, so we're looking forward to seeing you and all the other candidates.
I got to get through the primary.
You got to get through this primary because we know November 8th will be the real election day.
Yes.
But we want people to go out on May 17th, vote for Sharon McDonald-Evans, because it is important that people know that she is the one for this district. Thank you so much for talking to us.
You.
And thank you all for meeting the candidate.